Exosome treatment for neuropathy. A new area of regenerative medicine called exosome treatment has promise in the treatment of neuropathy. Small vesicles called exosomes are released by cells and contain a variety of proteins, lipids, and genetic material. They are essential for cell-to-cell communication and can transport therapeutic cargo to exact cells. Treatment planning, diagnostic testing, and patient evaluation are all part of the neuropathy process with exosome therapy. Exosomes are manufactured and delivered locally or systemically by injection or infusion. They are obtained from sources of regenerating cells. Adjunctive therapy may be suggested, and treatment response is tracked. By promoting nerve regeneration, neuroprotection, and anti-inflammatory effects, this customized strategy may be able to reduce neuropathic pain and enhance patient outcomes.